So hello and welcome back to my channel everyone. My name is Adil Ahmed and now I am going to enter third year of MBBS and my second year examinations have just finished. So now I can guide you for your second year exams, how you can approach the second year of MBBS, what things you need to study, which books you need to study, which materials you need to follow for video lectures, and how you should approach theory and how you should approach the practicals. With that said, let's get started with the video. In second year subjects, before going into the systemic part, always start with the general part of the subject. Like before going into the systemic pathology, cover the general pathology first. Before going into the systemic pharma, first complete the general pharma. Before going into the bacteria or virus part in detail, first complete the general bacteriology, general virology, general mycology, and etc. So with that said, let's get started with the theory part of individual subjects. In pharma, you have mainly two books, KDT and Shanbag. KDT is a thick book and tough to remember, whereas Shanbag is a thin book comparatively, which is easier to understand and easy to memorize, and it has things given in a systemic way that you can write in your exam. It has mnemonics, it has regimens, and very orderly arranged things, so it's better to use Shanbag. But if you need to go in detail, you can use KDT, but definitely you can't use KDT for exam purpose because it's very information laden, and that much information will not be asked in exam. For video lectures, I have used Marrow, and many of my friends and many others have used Jiaji Sir's lectures, which is in cerebellum, so you can choose accordingly. I have purchased Marrow, so I stick with Marrow, but yes, you can go for Jiaji Sir's lectures. It is amazing. I have also watched few of his lectures and his mnemonics are amazing. My friends always remember him for his mnemonics only. So yes, his mnemonics are amazing, and his teaching style is, just ask any of your senior, they will tell you. But yes, I stick with the Marrow. I think Marrow is also good enough. One thing I would like to tell you is, whenever you are studying a certain classification of drugs, always make a separate copy for that drug classification. It will eventually help you during the exam times where you need to study hundreds of drugs and classifications. So drug classification is like a quick revision of your pharma without reading the notes. So make drug classification. And also one thing which is asked in exams is drug regimen. So write the drug regimen, like regimen for TB, HIV, malaria and all. You can use Shanbag, it has properly given all these, and you can make a separate copy for regimen and drug classification, and your pharma will be done. For patho, you should have Robbins. I said have because you may not be able to read it fully, but at least you should have it. I have also read the general part. Whatever I could read, I read it during the initial period of my second year. Later, I also used Ramdas Nayak, which is a good exam preparatory manual. So in the starting, when you have enough time, you can start reading Robbins and then later shift to other books like Ramdas Nayak during the exams. I also have little guilt that I could not read Robbins fully. As I said, I have just read the general part, the initial few chapters only from Robbins. And one of my seniors always tell me that to become a good doctor, you need to study Robbins. I don't know if this is true or not. My seniors have told me. I'm mentioning it to you, so it's up to you. But remember, whenever you are reading, read it like a storybook initially at least. Don't try to mug up every single line because not every line is important. Read it like a storybook, understand whatever you are understanding at the moment. Later on, whenever you are having some doubts or misconceptions, you can just quickly open. At that time, you can clear your doubts. And as I said, it's a very hard to revise book, so during the exam, you can shift to a book which is easier for exam purpose, which has a question answer format of writing. Like Ramdas Nayak is a very good book which almost everyone has used in our batch. So it's a very good book for both the exams and in general concepts banane ke liye bhi. Again, I have used Marrow lectures. It is amazing. I loved it, and I always say to my friends, Patho is my favorite because how well the ma'am has taught me in the lectures. Ma'am's lecture is also based on Robbins, so that's also a good thing. So yeah, patho ho gaya, pharma ho gaya. Let's move on to micro. For micro, I have not used much video lectures. Many of my friends have recommended Dr. Preeti ma'am's lectures. I tried to follow Maro lectures. I even did 24 video lectures, but to be honest, I found it quite boring. So yeah, I did not complete the Maro lectures from microbiology. And the problem I faced was in micro, our college used a systemic approach, and all of the coaching modules or all of the video lectures, Maro, Prep, Tadr, Cerebellum, everyone has been using the system of organism wise study. Like in our college, the exams were being conducted based on general microbiology, then the systemic part like the CVS, bloodstream, GIT, CNS, and in Maro or other app, it's given in such a way that general bacteriology, then specific bacteria, the disease the bacteria cause. So these are arranged in organism wise pattern. So this was the issue I was facing initially. So जैसे second year आगे बढ़ता गया, I stopped using Maro lectures and moved on to reading books. Still, you can do some lectures from the apps like hospital acquired infections, immunity, and the general part, which is very important. So you can do this part from the app, and later on, when you are good enough to understand the systemic part, you can read the systemic part yourself. And for book, I will recommend Apurva Shastri. It is a very good book. The language is very easy to understand and it will cover all your micro needs. So no need to worry. Just get Apurva Shastri and you are good to go. For micro, you need to study the complete book at least once, but later on you can revise the important parts, and especially the lab diagnosis, which is mostly asked in exams. One thing you can do is write the lab diagnosis in your language separately in a separate copy. This will also help you during your exam times. Just like I said, make a separate copy for drug classification of pharma. So if you do this much, your theory part will be covered. Now let's move on to the practical part. For practicals, I don't know, it might be different for different universities. Mine is WBUHS, so I will be giving tips according to WBUHS. For pathology, you will be initially doing the same hematology and urine test which you first did in first year. So it's quite easy, and first year का revise भी हो जाएगा इसके साथ साथ. There's a book named M.K. Chaudhary which is a very good book for practical questions which is mostly asked during the Viva for practicals. It is a good book which is mostly used by students in our state, West Bengal. So you can use that book. Apart from that, there will be OSPI, for which the materials, the flashcard, the instruments and all that will be done in your college. So attend the practical classes, make notes and get all those flash notes, get all those flashcards from your college, write the answer for those so that you won't have to worry about the answers during your exam time. During our time, we had around 50 flashcards for patho only. So yes, it can get quite hectic, so prepare it accordingly beforehand. And for identification of specimen and slides, again attend your classes, attend your practical classes, and use the book Ramdas Nayak. It's good for the associated questions which may be asked along with the specimen or the slide. So this was for patho. Now let's move on to micro practicals. There will be bacteria identification, Zn staining and stool culture, which you need to see in microscope. So if you go to classes regularly, practical classes regularly, you will be good enough to answer these questions, and these are done throughout the year in colleges. So do it properly so that you can perform it properly during the exam time. Also there will be OSPI, where simple things like bacteria identification, species, flashcards, microbiological waste disposal, these things will be asked. So if you have a general idea of the theory part, you can easily do the OSPI of your practical examination of microbiology. Remember to make proper notes during your practical classes. It will help you a lot. Same for pharma. You will have prescriptions, ADR, drug-drug interaction. Even if you have general knowledge of the theory part, you can easily do the practical of pharmacology also. So this was it for your second year, and I hope this video was helpful for the second year. If you have any questions, just do ask me in the comment section and I will try to reply it. And you can also follow me on my Instagram, where I post quite frequently, and I have some other plans in this channel. So stay tuned. Thank you for watching. I'll see you in the next one.